This is the Insider Exclusive, live from West Los Angeles, California. We do have other big supporters of New Directions, and would you introduce who they're going to be?
Well, we have our clinical director, Matt Rohr, and he's coming in to talk a little bit about the comprehensive mental health care program. And also I'd like him to talk about the interns that he brings on board to help us work these things.
All right, let's do that right now. Welcome to the show, man.
Thank you for having me.
I've heard a lot of good things about you.
Well, thank you.
Tell us what you do at New Directions.
I am the Director of Clinical Services. We service about 150 veterans here at this location.
Okay.
50 of which are in a duly diagnosed department.
Yeah.
And out of those 50 individuals, they have individual services. We offer group psychotherapy.
Right.
And as well as adjunct therapy, including imagination workshop, somatic experience, and art therapy.
Okay. Now, that to the homeless vet,
Correct.
who's out there listening to this might be a little abstract. Okay, so when you say you are offering clinical services, what exactly does your organization do, your department?
Well, one of the things what's probably the most interesting is we really work with the individual, and especially the individual's trauma.
Yeah.
A lot of the general public, when they think of a veteran, they think of trauma as being combat trauma.
Mm-hmm.
When in the majority of the cases, that's not the case. It's complex trauma. And complex trauma is you can have a very negative, dysfunctional family, go into the military to kind of escape that environment. What the military doesn't share with you is that, you may be experiencing, bombed out villages, witnessing, horrific acts, and then you come out completely broken.
Right.
And generally, as the military and the culture, we suppress our thoughts and feelings. Yeah. So the first thing that a lot of these guys turn to is drugs and alcohol.
Yeah, to anesthetize themselves.
Correct.
Yeah.
And one of the things that we work with through a very safe and nurturing environment is to allow the veteran to work on their recovery, but at the same time process some of that trauma. We incorporate a lot of clinical interns with all of the different schools. Because of the public's focus on homelessness, a lot of the money has been given towards housing first. And one of the things about housing first is you simply can't take a vet that's been on the streets for 20, 30 years, that's struggling with mental health and addiction, and put them in an apartment and expect them to be
better.
Healthy.
Yeah.
And so one of the challenges that we face is because of that funding, a lot of our grant per diem monies, which is the money that was supporting mental health, was now taken away. So we've had to kind of enrich our internship program. And one of the
internship meaning these people work with volunteers
from all of different schools, from USC, UCLA, Pepperdine,
right?
And we've given them a really, really rich experience. And what's so rewarding for me as the director is to hear some of the students talk about their experiences with the vets, not only with the peers, but when they go back to their respective schools and they share the richness and the multi-layered of these individuals. Not only do their peers say, "Wow, we want to come and intern at New Directions," but their professors are so profoundly moved by their stories.
Right. I've often thought, because when I originally knew this program was just transitional housing, now you have permanent housing where you can put folks, veterans who have mental issues, in some of these permanent houses, right?
Correct.
In these apartments. How does New Directions, are you allowed to go into someone's accommodation, their apartment, if you're not hearing or getting communication from them? How does that work?
One of the challenges that we have found here is that we can have a veteran that, has successfully graduated the program
Mm-hmm.
and moved on to one of our permanent supportive sites. But because they didn't get the, adequate resources or social support or networking, they become very isolative. And we've seen some of these veterans, relapse.
Right.
And so in the 3 years that I've been here, we've had several gentlemen come back into the program again. So when Yvette came aboard, one of the things that her and I collaborated with is starting to expand some of our services so that when a veteran does leave here and has done well, is that we can follow them and be able to provide that therapeutic support
Right.
so that they can continue on their journey.
Yeah, but my question is, how do you communicate with unresponsive people?
That's challenging, but we do have case managers.
Yes.
Because
They follow up on
because technically they are apartments.
Yeah.
So we can't just walk in.
Yeah.
But we do, employ case managers that, already have an established relationship with some of the veterans in the apartments. So they can they have the ability to knock on the door and say, hey, would you like to continue clinical services? We think that, you might be needing help.
Yeah.
We have this service that you can provide, and so that's kind of our inroads.
Let me ask you this question, because as Yvette knows, I'm a recovering alcoholic and I've been sober almost 30 years. And one of the things I discovered in my recovery was the fact that deep down I thought I was a bad person. And that was extremely hard to overcome. I could hear what people said positively, you have a new life, you can do this, you can do that. But the years, when you talk about coming out of a complex situation, like a family situation, of being beaten down psychologically, how do you address that with some of these, for lack of a better word, troubled, really deeply troubled individuals?
I think one of the main lines of treatment is really working with the negative thought process through cognitive behavioral work, which is really dispelling some of those beliefs.
For example?
I am a bad person.
Right.
Or, I'm guilty because, I could have saved that person.
So if you and I were talking and I said, okay, you say that I should say, I am not a bad person. I'm not a bad person. I'm not guilty. I can mouth the words, but maybe I don't believe it. How do you get them to believe it?
By really dissecting, in the instance of war, or going into war. You didn't know that there would be women and children.
Right.
You didn't know you would be killing those people.
Mm-hmm.
That was part of the job, but you didn't actually think you were going to be witnessing that.
Yeah.
And so it's by saying, did you really have a choice in the matter?
What I like about the program is this, typically in the past, and I think still today, if you have a drug or alcohol problem, whether you're a veteran or not, oftentimes they'll send you to a 30-day hospitalization, right? And after 30 days, they say, go to a 12-step meeting program, develop it. Unfortunately, it's all a volunteer program, and unfortunately, the individual that you're recommending this to be done is not a social animal, if you will, okay? They don't have that support system. So what I love about this program is you're here. You're here all day long, 24/7, and nobody has to leave if they don't want to leave. Correct?
Correct. And one of the statistics that the National Coalition of Homeless Veterans, have testified to, that one of the best treatment programs is a structured transitional program where they get peer-to-peer, relationships.
Right.
And also we have a very active alumni program. So one benefit that New Directions for Veterans offers is we encourage the alumni to come back and actually become part of our program, just visiting with the veterans that are currently in the program. You'll meet our choir director. He is a graduate of the program.
Right.
So what happens is these veterans come back, the alumni come back, and they role model for veterans that are going through this kind of problem with substance abuse or addiction issues. And they show that there's another way.
Yeah.
And then a lot of our veterans, they graduate from the program and then they come back and they want to help. They either help by volunteering or they help by giving money so we could continue these programs, or they help by offering jobs or training or so forth.
I love that whole idea. It's like in the 12-step program. I love it because it's witnessing. I'll give you an example. When I first came to AA, which is 29 years, 6 months or whatever ago, I thought of myself as, I never could recover, right? But I listened to a guy get up there and speak about the epiphany he had, which changed him to seek a sober and clean living life. and that was he was supposed to be watching his daughter in the bathtub. He passed out. She drowned. You know, tragic situation. And I said to myself, if he can do it, I can. So I love that, you know, I love that program, you know, that witnessing, you know, that mentorship. A lot of people, like in the 12-step program, you know, there's a step where you have to write down a personal inventory. And I remember 30 years ago when I tried to write it, I stared at a blank page for 3 days. You know, because it's difficult because you don't, you know, you haven't really looked at yourself. Do you implement that a little in your program too?
Absolutely. One of our core rehabilitation groups is recovery, and that's where I do get a lot of my interns kind of the freedom to kind of utilize their creative juices to work with recovery in a kind of a different manner than like a 12-step program, where they're introduced music, poetry, art.
Do they get some sort of college credit for doing this?
Oh yeah, they get hours.
They get hours,
so there's a
so they can
trade-off.
put it like on their resume.
Absolutely, absolutely.
So this would be good for people who are in the...
It's excellent.
Thank you very much for being on the program. Keep up the good work.
All right, thank you.